Everyday injustice. Too many wrongful convictions. Corruption has infected the criminal justice system, leaving too many people helpless, fighting for their lives. Instead of receiving justice, people suffer. Is that why they say justice is blind?
Today on Everyday Injustice, we are talking with Amanda Hall. She is the Senior Director of the National Campaigns, and they've been working on Public Health is a Public Safety campaign. So let's start with kind of your background and how you got involved in all of this.
Yeah, absolutely. And thank you so much. I'm excited to talk with you today. Um, but yeah, my name's Amanda Hall. I live out in Kentucky, Eastern Kentucky, so deep Appalachia. And growing up, it was pretty rough out here. And unfortunately, the criminal legal system has been involved in my life since I can remember. My mother is formerly incarcerated. She had some substance use issues due to a lot of trauma and domestic violence. And early on in my early teens, I actually developed a substance use disorder. I was also out here, a lot of popular shows like Dope Sick and things of that nature that talk about Purdue and the opioid crisis. And this was the genesis of this. So in my early teens, things like Oxycontin was in absolutely every medicine cabinet everywhere. My father was a coal miner, everybody in my family. So early on, it was kind of just experimenting, not really knowing what I was doing. I also had a lot of some mental health issues that were unaddressed. And I found myself involved in the criminal legal system as well, especially after I got a prescription for high powered pain pills. And yeah, so I got arrested the first time in my teens. I got really lucky and was taken to school instead of juvenile detention. But at the age of 18, I started cycling in and out of county jails. I spent from 18 until my mid 20s either in a county jail, some kind of, I ended up because of my mental health, psychiatric facilities. So I was really just institutionalized. In my mid 20s, I went to prison for the first and only time. I received drug trafficking charges for 2 prescription pills. I was given 2 5-year sentences and sent at the time it was a max prison. Now it's a mixed security. But yeah, and that changed my whole entire life. I was a young mother and didn't see my children for years, was, hours away from my family. Um, and after that, finally, I received help. I finally was able to get help for my mental health issues and substance use disorder. And going through all of that and just seeing systems fail repeatedly, me as a child, failing my children, failing my mother, who is a victim of violence, and she didn't even get help within these systems. It really ignited a fire in me. And yeah, I started my journey within advocacy and working in this space after all of that horrible stuff.
And I think it's really important for you to be a face that people kind of associate with these kinds of problems. And I don't mean that flippantly, but I think a lot of people have a very different conception of what the face of substance use disorder is. And so I think it's really important for people to get maybe a better perspective on that.
Mhm. Yeah, I mean, the stigma and what we are taught, is so destructive. I remember from that even being mad at my mother because she had a substance use disorder, and that meant she was a bad person, and she wasn't. I was so confused as a child because she was so loving and tried her best, and I'd seen her be treated so badly and by people and by systems. So I really think when it comes to stigma and understanding substance use disorder, yeah, we all, myself included, have a long way to go.
So tell us about your work now, and also kind of bridge that gap between, your own problems and kind of getting past those problems, and then being able to actually work in this field.
Yeah, absolutely. So after prison and after I received that help for my substance use disorder, I knew that I wanted to help other people. I knew that that's when I felt the most kind of aligned with purpose. I don't know what to call it, but that's when I felt the most whole when I was helping others or involved. So I went to college to be a social worker. After prison, it's so hard to reintegrate. Nobody would hire me. I couldn't find anywhere to live. They almost didn't let me go to college. I had to write all these essays and beg and tell them, I'm sorry for all the things I've done. And luckily, they finally let me go. I just couldn't live on campus. But I fought really hard. I did finally find a couple of jobs. They were part-time because of my criminal conviction. But I went to school to be a social worker, and I wanted to do direct service, one-on-one, especially with women who had substance use disorder or had been incarcerated, had mental health issues. And I did that for quite a while. And it came to a point where I felt like I was lying to them. I ran a large recovery center in Kentucky, and I kept telling them, you do what you're supposed to, do what your parole officer says, like do all of these things, and life would get better. But that wasn't true because I couldn't find them anywhere to live. I couldn't reunite them with their children. I couldn't, do all of these things because of these systemic policies that stood in the way. And I really started thinking, like, that's what I want to do. To help in the capacity that I want to, that's the work I want to do. So I ended up going to work at the ACLU of Kentucky for 4 years. I built a group there. It was directly impacted folks in Kentucky that had been incarcerated. So many of those folks had their own mental health or substance use disorder journeys. And we fought in large coalitions for a bunch of different bills. We worked with Republicans, Democrats. I mean, anyone who would work with us. Our purpose was to help the people we left behind. And we're really successful. We passed over a dozen bills in coalition in a place like Kentucky where people may not suspect that would happen. But then I heard about dream.org, where I work now. So they're a national organization. And I've worked here for around 3 years and get to work in states all across the country. We work with directly impacted people, teach them about advocacy, how to make systemic changes, how to use their voice and build coalitions. And it's really, it's a dream come true. I've learned so much and worked with so many amazing people across the country. And yeah, we just started a brand new campaign called Public Health is Public Safety.
And we'll get into that in a second. But I think there was something really important that you mentioned, because you said, well, you start talking to people and saying, well, if you just follow the directions and everything, that everything will be fine. And then you realize, no, that's kind of a lie. And the reality, I think, is that not only is it a lie, it's far worse than that. We've designed a system that makes it impossible for people, or not impossible, because obviously people do get past it. But it makes it really difficult for people that are struggling with their lives to then, be able to get things like housing and jobs, and get loans for education. I mean, everything that we want people to do when after they've been incarcerated, we make it really hard, and it doesn't make any sense.
No, I mean, 1,000,000%. I remember my parole officer telling me you have to find somewhere to live. I was literally staying at a shelter for folks that are unhoused. She said, you have to find somewhere to live. Like, you can't stay here anymore. Nobody would rent to me. Like, I would call places and we would be fine. And then they would say, oh, last question. Have you ever been convicted of a felony? And I would say yes. And literally, I've had people hang up on me. And I have sat in my parole officer's office in tears, like, help me. I can't find anywhere to live. Or I came out and I owed all these fines and fees for being arrested. I had to have all of these paid tomorrow, or I'm going back to prison and nobody will hire me. It is 100%. It's set up to fail. And some people do succeed, but it's because of that outside support. I got really lucky and met a bunch of people in recovery that supported me and loved me. I know for a fact that my life would have been completely different. I may not even be here. Like, I may not be alive truly if it wasn't for those. So, in spite of that system did not help me rehabilitate. I rehabilitated in spite of that.
Right. And unfortunately, your story is not unique. That's the way the system is, and I think that's part of what this public safety campaign is about, right?
Mhm. Absolutely. So for so long, we've criminalized so many behaviors, and that hasn't really worked out. Incarceration rates continue to rise. Our overdose rates, even though they're starting to decrease, are still astronomically high. So this campaign really looks at building a system of care. Like, how do we fix the problem kind of at the roots? How do we make sure that people have the things that they need to address the issues that they're going through? We work on a lot of bills when it comes to reentry. One bill that we've been working on is called the Restore Act. It's a federal bill, and we work on it with Drug Policy Alliance. But since the 1990s, folks who have a felony conviction for a drug conviction can be denied SNAP benefits, which is food assistance. A lot of states have modified it, but there are still so many states. In the state of South Carolina, you could never get SNAP ever. And that was really important to me, like the first couple of months I came out of prison. Because, like I said, I couldn't find a job. I couldn't. And I truly believe things like that is why we have people that have to, commit a crime, if they can't feed themselves. So, yeah, in this campaign, tearing down a lot of those barriers, making sure in prisons and jails people have access to substance use disorder treatment. It's mind blowing how many jails or prisons that have nothing, and it just perpetuates. And we see when people leave jail or prison, they are 10 times, some studies 29 times more likely to die of a fatal overdose. It is so really looking at what that care looks like, really trying to and I believe when those folks get better, our communities get safe. Our communities are better, families are better and stronger. So yeah, that's what the campaign's really about.
Yeah, and I think this gets to the point that we made earlier, is that we argue that all these quote unquote tough on crime policies are supposed to generate public safety. And the reality is that what generates public safety is getting somebody out of prison and into a job so they don't commit another crime. And what we're doing isn't helping that. So I feel like this is critically important. So talk to us about, the opioid crisis and how you see the best approach to fighting that.
Yeah, so the opioid crisis, it's had so many iterations at this point. I talked a little bit about um, rural communities in Appalachia and places like rural Maine, back when drugs like Oxycontin hit. But even before that, there had been opioid crisis in more urban areas. And now we see even a different iteration when it comes to fentanyl and the number of folks dying. So, with this crisis, we have to have a multi-pronged kind of attack. The war on drugs has always been a war on people, so we don't need any of that. We need, better prevention and education when it comes to drugs. We need to make sure that people have things like Narcan on them to, try to prevent fatal overdoses. We need to make sure that when someone seeks treatment, they can get into it. When someone wants substance use disorder treatment, waiting weeks for a bed, like that's not going to work. Like you have a short window, people die waiting. There's never a wait to get in jail, like why we need to make sure our laws treat mental health in the same way it does like physical ailments, like things like mental health parity. And we need to remove those barriers for people who have went through that criminal legal system. We have to make sure that people have access to housing, that people have access to employment, things like clean slate, which clears a person's record. So it has to be all of these different prongs. It's a very complicated issue. And unfortunately, for a very long time, we've tried to make it not that way and just punish it to death. And it has not worked. It has really harmed us. So that's why, when public health is public safety, when I explain it, it has so many different prongs because we need all of those different kind of means of attack.
Yeah, I think it's really interesting. I was reading a book a few weeks ago, and it talked about how we've kind of generated the opioid crisis on our own. First of all, by over prescribing prescription drugs, but then the brilliant solution was, well, we just cut back on over prescribing the drugs, and the problem will go away. And no, it doesn't work. What happens is then people have to seek out street drugs, and the problem with street drugs is you're like injecting all sorts of crap into your body, for lack of a better term. And so if we just monitored the way that what people were taking and gave them a safe injection site, for example, it'd be much more safe, and they'd be much less likely to get infections and less likely to overdose, and then we can deal with kind of the underlying issues, because it turns out most people that just take a drug aren't going to get addicted. People that get addicted are addicted for a reason, and unless you can address that reason, you're not going to really solve addiction. And so the whole system is backwards, wouldn't you say?
No, a million times. And like the way you were talking, like prohibition. When I talk about the different iterations of the opioid crisis, we can look at it with all drugs. When we start to criminalize or, come down on one drug, here's a brand new one. that's even more dangerous, even less controlled, like you said, because it's from the streets, things of that nature. Like we had to look at this in a whole different lens. And I also love how you upheld that everyone that does drugs does not have an addiction. That's very, actually it's not a whole lot out of the amount. Think about how many people does drugs. So having these punitive laws really make no sense whatsoever. So we have to kind of rewire and talk about this in a different way too.
Yeah, I mean, by way of example, I smoked cigarettes from the time I was a teenager into my 20s, and probably for about a 10-year period. And I quit, and I had no problem quitting. And nicotine is one of the most addictive substances around. And it turns out that more than half of people that smoke cigarettes are never actually addicted to it. Um, you know, and so it's an interesting thing that people don't think about. They think, oh, you do a drug, you get addicted. No, not necessarily. I mean, some people do, and I'm not going to diminish that or downplay it, but a lot of people, and the other interesting thing, is people can like inject heroin 3 times a day and be a heroin user. They can go to work, they can be productive. It doesn't have to be devastating. Where it becomes devastating is to figure out where your next fix is going to come from, and then rob a bank or rob a store to get money for that next fix. If that part of the equation is taken out of it, the actual process of taking the drugs, while probably not the best thing in the world for you, is not as debilitating as people think it is.
I mean, 1,000 times, or even those drugs, become dangerous because, like you said, they're out on the streets. That's why we really fight for a lot of different drug testing. We have passed bills around fentanyl testing strips, things of that nature. Because if people use drugs, we don't want them dying. Like you said, so many people use drugs and lead productive, great lives. Um, and looking at it under that umbrella of everyone has an addiction is pretty rough. And then you layer it on, well, everybody that has an addiction, the only thing that you can do is criminalize them and make them stop. So it is like really piled on and really help with this whole entire crisis. And even people that want to seek things like methadone, which is a tried and true, medication for opioid use disorder that's been around for a long time. It's so restrictive for people to even get that, especially in some of the states we work in. Rural communities, people driving an hour a day to go get medication. Like you have to come into the clinic every day and dose. So we work a lot on expanding on the harm reduction side and making sure to expand MOUD and other mental health treatment resources for people who want them.
Now, I'm kind of curious, in Kentucky, what do you see as the barriers to kind of a more sensible drug policy?
I mean, that stigma, that lack of understanding for people who use drugs and or people who have an addiction and want treatment. Here it's just very punitive measures. If we punish somebody enough, they will stop. We don't like this. Yeah, I mean, that's it. We don't like this. If we punish them enough, it will stop. I will say we have definitely had some success. We've had movement. We were able a few years ago to work with an amazing representative to pass a bill that took away pre-authorization for Medicaid assisted treatment. So what that meant is somebody would go and need a medication like Suboxone, and the doctor would prescribe it, but then the insurance company would say, give us however long. And people were dying waiting for that authorization. So we've expanded that because there was a huge stigma, and still is in a lot of places, around MOUD. We have worked to pass the fentanyl testing strip bill to make sure that people can test their drugs and know what type of drug that is, if fentanyl's in it, so they can take proper precautions and keep themselves safe. So we have made movements. Unfortunately, this year, there's a very regressive bill that passed. It was all around our unhoused and, making it illegal to camp. And the only way you can get resources is if you also do some type of a program. And like me and you both just said, everybody doesn't need a program. Like in Kentucky, we had a ban on SNAP benefits. I'm a person in recovery, but I am such a lover, supporter of harm reduction because I have been around so long and have watched so many of my friends die needlessly. So that ban on SNAP, you could get SNAP benefits for you and your family, but you had to complete a substance use disorder program if you have a drug felony. Not everybody that has a felony, could be a kid got caught for possession or somebody, needing to sell drugs to get by. So it was just things like that people sometimes genuinely think they're helpful, but are very harmful.
So Amanda, how can people find out more about the work that you and dream.org are doing?
Yeah, we would love for folks to join the campaign. Come over, volunteer, help us out. Maybe we're doing work in your state or help us on some of these federal bills. You can text 98743, the word care, to 98743. You can also visit dream.org. That's our website. On there, you'll see a huge load of events that we have, our virtual events. In the next couple of months, we'll have Day of Empathy, which is in states around the nation. It's a day at state capitals to talk about criminal justice, to talk about things like public health as public safety with elected officials and people in the community. So definitely visit dream.org to check all of that out. Yeah.
Well, great. Well, thanks so much, Amanda, for joining us. Everyday Injustice. We've been talking with Amanda Hall from dream.org and their public safety campaign. And I think it's really important to emphasize right here at the end that smart on crime safety, because when you throw somebody in jail, throw them in prison, throw away the key, make it impossible for them to get back on their feet, you're actually leading to more crime. Whereas if you give people opportunities, they will take advantage of them more often than not. This has been Everyday Injustice. I'm your host, David Greenwald. Join us again next week for more tales from the injustice system.
Thank you to George Powell and Norman Mousequake Barrett for the use of our opening, Everyday Injustice. You can see more of George's music at www.justiceforgeorgepowell.com. That's Justice for George Powell, all one word, .com.